Do your hands ever tingle? Do they get that weird pins and needles sensation like they've fallen asleep? Tingling is a really common problem, and oftentimes it's benign, not a big deal, but it can be due to some serious and scary causes. I'm a neurologist. I see a lot of people who have tingling, and in this video I'm going to tell you about 5 of the most common reasons why your hands may have tingling. So, let's dive in. Welcome back to another video. I'm Dr. Parker Bohm. This is NeuroWorld-MD, and we're going to go ahead and get started with number 1. So reason number 1 is compression of some nerves and potentially even nerve entrapment. So when a nerve gets pressed on, it causes some tingling sensations to go up to the brain. And the more and the longer it gets pressed, it can cause damage to the nerve, which can cause not just tingling, but permanent numbness. So for instance, you pinch your fingers and you feel some sort of dull pressure, but you don't really feel that pinch. Or if it's really bad, even weakness of hand muscles. Now, nerve compression can be due to a lot of different causes. For instance, even me, when I'm sitting in certain positions, like this, working on a laptop or something like that, and I'm on my elbows, I will get some tingling and numbness in some of my fingers. That is common. So when people have tingling and numbness that is temporary or comes and goes, and it's associated with just some certain positional changes, that's generally a benign issue because the nerve is just temporarily being compressed and no permanent damage is being done. But I'm going to talk about 2 very, very common causes of nerve entrapment in people who have tingling and numbness. So the first is what we call carpal tunnel syndrome. So we all have a median nerve that supplies sensation to our hand, okay? Classically, in medical school, they talk about how it supplies sensation to these first 3 digits or fingers. But honestly, some people with carpal tunnel syndrome have numbness of the whole hand and rarely can actually cause numbness of just the pinky finger. Now, with carpal tunnel syndrome, it can be due to a lot of different causes, but it is more common that you see this in people who work with their hands a lot. I've seen mechanics with this, massage therapists, people who like to knit a lot, but some people don't really have any of those risk factors. What symptoms does carpal tunnel syndrome cause? Well, it can cause tingling, like I talked about. It can cause numbness, and it can make people just feel like they're dropping things all the time. So many people experience this when they wake up at night and they just have pain in their hands and they kind of have to shake it out. That's a very common symptom that people describe who have carpal tunnel. Sometimes driving, just using a steering wheel can cause this. Sometimes typing can cause symptoms of carpal tunnel. So carpal tunnel syndrome is something that, if it's mild, can be treated conservatively without surgery. So trying to prevent the wrist from bending and squeezing a lot of times people at night will wear what's called a neutral wrist brace, which can just be purchased from local pharmacies or on the internet to help basically keep that median nerve at night from being pushed on and bent. And over the course of a couple months, sometimes the median nerve can heal up and get better and symptoms can go away. But if the carpal tunnel syndrome is more moderate or severe, and I'll talk about some ways that we can actually characterize that at the end of this video, it oftentimes would need surgery actually to prevent further nerve damage. Now, what's called ulnar neuropathy is very similar, but this is classically an entrapped nerve at the elbow, and this oftentimes causes numbness of the 4th and 5th fingers, kind of isolated due to ulnar nerve problems. And again, at the end of the video, I'll talk about a way that this can be diagnosed. Now, many people have just temporary tingling feelings that come and go, but again, if they are temporary and transient and they're associated with just being in a certain position, that is a normal finding in a lot of different individuals, including myself. So anyway, we're going to go on to number 2. So here we go. Okay, the second reason we're going to cover for possible reasons why people may have tingling in the hands is actually due to neck issues. How's that the case? Well, we have our brain, we have our spinal cord, but off of our spinal cord, we get these nerve roots. The nerve roots go down and actually supply sensation and strength to our hands. So if there is a nerve root problem, it has a fancy medical term, and that is what's called a radiculopathy, coming from the Latin word for root. the nerve root up here. Now, if somebody has a radiculopathy, there's a lot of different potential causes, but by far the most common cause of radiculopathy is when people have some nerve compression of those nerve roots as they go through the vertebrae or the bones that protect our spinal cord. So there are some certain foramina or little holes where the nerve roots normally go through, but as we age, it's very common that we develop wear and tear changes, sometimes called degenerative changes or arthritis, that can cause bone spurs or narrowing in those little holes, so the nerve root is actually getting compressed or squeezed. Now, this classically causes symptoms that radiate down from the neck all the way down the arm and even into the hands. So, like for instance, if your C6 nerve root is being compressed or pinched, it oftentimes causes symptoms of your thumb and your pointer finger in this distribution. And for instance, if you have a C8 nerve problem, it oftentimes causes issues more over here. Everybody's nerves are different, and again, many people just will experience their whole hand being numb, even if it's just one of those nerve roots that are being pinched. But we need to remember the possibility of pinched nerves in the neck causing these issues. Now, if people have a herniated disc or a slipped disc, let's say they're lifting something super heavy and all of a sudden they get major pain and numbness and weakness in one arm, that is something that's happening because the nerve root is actually being compressed up there by a disc that's supposed to normally provide padding between the vertebrae, but instead it slips out and it oftentimes is pressing on those nerve roots. I have seen people who have undergone unnecessary neck surgeries because they have hand tingling, and the hand tingling ends up being due to carpal tunnel syndrome. So keep that in mind. Just because you have tingling in the hands does not guarantee that it's coming from the neck, although that is a possibility. So now we're going to go on to the third reason that your hands may tingle. Here we go. Okay, so number 3 is admittedly a rare cause of tingling in the hands, but I do want to mention this. This is something that is more likely to happen in younger people, maybe in their 20s, 30s, 40s, but can happen to people of any age. So let me tell you a brief story. I once saw a young lady, she was in her 20s, that came to me because she had had an episode of hand tingling bilaterally, so on both sides, that came on rather abruptly and then lasted for a few weeks, where she just felt this intense numbness and tingling in her hands, and then it just kind of gradually went away. Now, she had seen her primary care doctor about this, and it had been chalked up to possible allergies, and she was put on a course of corticosteroids or prednisone for a short time, but she wasn't necessarily satisfied with that answer, so she wanted a consultation with a neurologist. Now, when I saw her, she had a normal examination, meaning even when I used a little safety pin type thing and checked her pinprick sensation and checked her temperature sensation, she could feel the cold. She could still feel a vibration sensation in her hands from a tuning fork. Her reflexes were normal. Her strength was normal. But because of her story of this coming on in both hands rather quickly, in her case, I wanted to order an MRI of the brain and the spinal cord. So not looking for carpal tunnel syndrome, not looking for ulnar neuropathy, not looking necessarily for a pinched nerve in the neck, but looking for the possibility of inflammation in the brain and spinal cord. So in her case, unfortunately, when we got the test results back, they did show that she had had some old areas of inflammation, not just in the brain, but also in the spinal cord. And sure enough, she had a lesion on the back part of her spinal cord, in the sensory part of the spinal cord, and it was right in the middle of the spinal cord, the mid-back portion. And sure enough, that old spot of inflammation is what caused both of her hands to develop numbness, even though she didn't necessarily have weakness or major balance problems or weakness in the legs or other symptoms that people with a spinal cord problem may have. So in her case, she was unfortunately diagnosed with something that we call multiple sclerosis. Many people know this as MS, and this is a chronic autoimmune process where our body attacks our own brain and our spinal cord. So this is very important to diagnose because typically starting treatment for multiple sclerosis earlier in the disease course actually prevents more and more damage from being done. So in her case, it was very important to find that out and not just chalk it up to possible severe carpal tunnel syndrome that just kind of came and went. So that was the third reason. Now we are going to move on to number 4. Okay, the fourth reason that I'm going to cover today is something that we call neuropathy. Now, many people have heard of neuropathy, but most of the time when we hear about neuropathy, we're thinking about something that is affecting the nerves called the peripheral nerves. So not the brain, not the spinal cord, but the nerves that actually go down to the arms and the legs and actually other parts of the body. And in peripheral neuropathy, classically, this is most commonly associated with age or sometimes with diabetes or vitamin B12 deficiency, so low vitamin B12 levels, or sometimes even alcohol. Excessive alcohol use can definitely cause peripheral neuropathy. I've seen a lot of people with a lot of different causes of peripheral neuropathy, and by no means have I listed all of the different causes. There's a ton of different causes of peripheral neuropathy, but it can cause some tingling in the hands. Now, important caveat. Most of the time, people with peripheral neuropathy will start having symptoms in the toes or in the balls of the feet, and then they slowly move upwards, oftentimes over years, to involve kind of the shin area, and then goes up to about the knee. And once symptoms have gone up to about the knee, then people can start to develop symptoms more commonly in their hands. But there are some other more rare types of peripheral neuropathy where it may actually start with the hands first. Now, when it starts with the hands first in peripheral neuropathy, that is an atypical type of peripheral neuropathy. It makes us more concerned about possible autoimmune causes or some different metabolic causes. Oftentimes that would be associated with weakness of the hands, incoordination, so people are trying to put on their glasses but they're accidentally whacking their face because they're just losing their coordination, or balance problems. Those are all red flags for some unusual or atypical types of peripheral neuropathy. I once actually saw a lady who had developed severe burning, pain, and numbness and tingling, so sensory symptoms, or sometimes what we call paresthesias, the medical term for tingling and abnormal sensations. And when I saw her, I tested her blood for vitamin B6, and her vitamin B6 levels were actually not low, they were excessively high. And high vitamin B6 levels can actually cause a painful peripheral neuropathy that affects the hands and the feet. So in her case, she was actually supplementing with vitamin B6, and we just recommended that she stop her vitamin B6 supplement, and then her symptoms ended up getting way better. So that was just a relatively rare cause of peripheral neuropathy, but it's not to be forgotten as a potential cause of tingling in the hands and feet. So let's move on to number 5. We're almost there. Okay, so number 5 is something that's actually a group of different things I'm going to discuss. And the first thing I'm going to discuss is an overlap syndrome between what is called fibromyalgia and functional neurologic disorder. Now, many people have heard of fibromyalgia. A lot less people have heard of functional neurologic disorder, although it's extremely common, and I see people with FND or functional neurologic disorder pretty much every week in Neurology Clinic. Fibromyalgia is a poorly understood disorder where people develop chronic pain throughout the body for kind of unclear reasons. We don't currently have a specific blood test to diagnose that. Functional neurologic disorder can be on the same spectrum, so some people can have both. But this is where people develop neurologic symptoms, and their MRI of the brain and their MRI of the spinal cord and all the other tests that we can do in neurology don't really show a clear cause. This is more thought of as a disconnect between the brain and the body, and the way the brain is perceiving signals, and sometimes the way the brain is trying to get the body to work. There's this disconnect. So in fibromyalgia and functional neurologic disorder, people can develop these tingling sensations and sometimes pain and sometimes even weakness for no clear reason. So all the tests come back as normal. And I have seen so many people in clinic where this is the case, meaning they just have these chronic paresthesias or these tingling and numbness type feelings that maybe they can be all day, maybe they can come and go, but they don't really have a clear explanation or a clear cause that we can test for. So when I see these people, I still do a full workup. So for instance, I check different blood tests depending on what's going on. I might check an MRI of their brain or spinal cord, or what I'm going to end by talking about, check an EMG, which is actually the best test to look at the peripheral nerves. But if that all comes back as normal, there's a good chance that FND or fibromyalgia could be what's causing the symptoms. Now, there are some treatments that can be tried if the tingling or burning sensation is really bothersome, but those treatments are more what we call symptomatic medicines. They're just trying to help calm down the symptoms. They're not actually changing what is the underlying cause that's actually causing issues with the nerves, because in functional neurologic disorder and fibromyalgia, the nerves aren't actually truly being damaged in a way that we can measure. It's just more of the perception from the brain of the nerves just firing things off inappropriately. And the last thing I wanted to mention as a cause for tingling is basically either anxiety or hyperventilation. So sometimes anxiety itself can cause people to hyperventilate or breathe too quickly, or other things can cause hyperventilation as well, like if you're having actual breathing issues, or if your body is going through something physically stressful. But when you hyperventilate, it actually changes the pH of your blood, and when your blood pH is off, your nerves are not firing correctly. So that in and of itself can cause some tingling feelings in the hands or feet, or sometimes even around the mouth. So don't forget about the possibility of anxiety or hyperventilation causing some tingling feelings, although this would tend to be more situational and temporary. Now, I told you earlier that I was going to tell you about a way to help diagnose things like carpal tunnel syndrome and ulnar neuropathy, and that is something called an EMG in nerve conduction studies. This is oftentimes called electromyography, but if you've heard EMG nerve conduction studies, this is what I'm talking about. So this is a test that is commonly done by neurologists or other physicians, like for instance, physical medicine and rehab doctors. It can be done by some other specialties, non-physician specialties like chiropractors and physical therapists. Personally, I would have a lot of reservations having a test by one of those providers, just because it's highly likely they have not gone through the same rigorous training that the physicians that perform this have gone through. But anyway, when we do an EMG, basically we use some low-level shocks that can kind of hurt, but most people tolerate it quite well, to actually see if the nerves are doing what they're doing. So we'll shock the nerves at different locations and then measure how long it takes, or the machine measures how long it takes to get to point A from point B, to see if the nerve is healthy. Because if it takes a long time to get from here to here, that means there has to be an issue where the nerve is causing slowing, like for instance here, which can diagnose carpal tunnel syndrome. Now, an EMG is very helpful for categorizing how severe carpal tunnel syndrome is, or ulnar neuropathy, or sometimes it can show if there's an issue due to a pinched nerve. Although the way our anatomy is actually set up, you can have a pinched nerve that's just causing sensory symptoms, and the EMG won't necessarily pick that up. A lot of doctors don't know that, so that's something to keep in mind. The last thing I wanted to mention about an EMG is it is not 100% sensitive, meaning it's possible to have some mild carpal tunnel syndrome and the EMG doesn't pick up on that. Sometimes using what's called neuromuscular ultrasound, using just an ultrasound machine, can also look for changes associated with things like carpal tunnel. So an EMG may be ordered by your healthcare provider to try to figure out what may be causing the tingling. So anyway, in this video, I just wanted to give you kind of a rather concise, but still at the same time trying to be somewhat comprehensive overview of different things that can cause hand tingling. Obviously, I'm not actually examining you. I can't hear your story, so I can't diagnose you and tell you what the most likely cause is. But hopefully this video provided some information for you. I'd encourage you, if you're having excessive problems like this, talk to your healthcare provider, try to get some answers, try to rule out some more serious or dangerous causes, because even though carpal tunnel syndrome is a relatively benign thing compared to a lot of things that we see in medicine, like I said earlier, it can cause some permanent damage, permanent weakness if it's not dealt with. I make neurology content. My goal is to make high quality educational neurology content. It's an honor that you are watching this video. If you're still watching, it would be amazing if you could like the video, subscribe to the channel, and if you think it's worth it, share it with a friend or family member. But I will catch you guys later. Peace. By the way, click this link up here in the corner if you want to hear the story about a lady who felt like her eye was falling out when she would bend over to tie her shoes, and what the diagnosis ended up being. Okay, see you guys for real this time.